Well, there's something new in Ghana. The government has put out a number which you can actually call and get food delivered to you for free. Yes, I'm talking about this country, Ghana. You'll actually get water supplied to you for free for the next 3 months. And if your tap has been disconnected for non-payment of bills, your service could be restored and the debt put on hold for the next 3 months. It doesn't mean you won't pay, you will pay, but that's after these 3 months. Now that sounds like paradise on earth for some of us. All these are part of side-ranging social interventions announced by government to minimize the impact of the lockdown and other brutal measures introduced to halt the spread of COVID-19. President Akufo-Addo mentioned this in his 4th COVID update to the nation on Sunday. Actually, it's 5th on Sunday. But today, his ministers responsible for water and sanitation, gender, children and social protection, as well as information, have been given details of these interventions as government updates the country on the management of coronavirus cases here. We'll hear from them shortly. First, though, the senior minister who's been given details about the number of persons who are being fed by government in the lockdown areas in Greater Accra, Kaswa and Greater Kumasi areas, says this.
One of the challenges of us during the lockdown is feeding those who are very vulnerable. It is a big challenge, and as the government suggested, we intend to feed about 400,000 minimum people in the lockdown areas. Thank you for all those who have seen the need to come and support the government and, by extension, the COVID-19 Trust Fund to cater for those who have been disadvantaged by COVID-19.
All right, so that's the senior minister there who was at the press conference today. Head of our health desk, Fred Smith, was at that press conference, and he joins me in the studio with more. We'll start from the relief packages announced today for vulnerable people. Fred, tell us more.
Well, great stuff there. The gender minister announcing that they've started serving people food in Accra. They're extending it to the other lockdown areas, and so they identify those who would need it and then they give them. They've also advertised telephone numbers where people who need food, and because of the lockdown they cannot move, they don't have anything with them, they can call and food will be delivered to them. Right. To also deepen this process, they are also engaging persons who already prepare food in the communities, so that in your localities, who sell in their localities, they will be given resources to produce the food and then serve to those around. Right. And they want to get people who know the community well, so that they know who are coming for the food. There must be some kind of accountability. And the gender minister, Cynthia Morrison, gave those details at the news conference. We can hear her. Right.
You said you saw Kaya working, and yet you are providing for them. You are providing for everybody. There are people who are also doing manual jobs that we are still providing for. But the exception is not Kaya, it's for everybody. And another person said he went to circle and on Osu, and they said there was no food. Father Campbell is doing food at Osu and Circle. And that I can assure you, it is done every day. There are people who would get food and then go back and tell you they haven't gotten. When I was going to work, there are people right in front of the National Theatre, they were eating. Whilst I was coming here, they were all moving towards the Ministry of Gender because we gave them food yesterday. Yesterday, even at the Ministry of Gender, some came to take food. He went away, he was wearing a cap. He put the cap and wore a scarf and then came for the food. It's natural. And so, but for places where there's no food, we'll make sure that we send food to, so don't worry. With disability, we are with them, we have their quota. You go there now, we've packed them. Their director, Auntie Akuya, is right there in the ministry to take their food. They cannot move out now. So the distribution is not like bringing them all together and do the distribution. They are going to get their food. Some have already gotten, and others are going to get. We have a group of people at the stadium, Olympic people who are going to play games, and they couldn't. We've sent their quota.
So that's the Gender and Social Protection Minister there. Fred, do take us through again the numbers that people are supposed to call if they identify themselves as vulnerable people who need this intervention.
Well, I think I recall 800.
800. That's
yes.
it. 800. That's not difficult at all. But don't prank this line. I mean, over the weekend, MFR Powell had the chance to go to the call center 311, and when she went there, she picked some calls, and someone said
they wanted food.
Yes.
Okay. So now there's a contact to call for that food, and I can only imagine how those who work there, the call center operators, will be inundated with calls because almost everybody
wants food.
Yeah.
So, well, but if you don't need it, you don't need to call it, so that people who actually need it can have access to it. Well, Fred, government has actually also rolled out a plan to get water to every Ghanaian for free for the next 3 months, and that's what a lot of people are excited about. How exactly will this happen?
Indeed, the president, during his interaction with the nation on Sunday, mentioned this, but we have the sanitation minister giving us details, and so tankers are going to be sent round to areas where they don't have water flowing at all. In areas where there are pipelines but water cannot flow to those areas, they will also have tankers going there. In areas where there are community water systems supplying, selling to people, it will be free because government is going to pay them end of the day. If there's somebody who is selling water to people in a certain community and that's what their livelihood depends on, then those people are also going to be paid by Ghana Water, so they're not supposed to sell. People must just come, fetch, and go home. The plan was also explained by the Water and Sanitation Minister, Cecilia Abnadapa, at this news conference.
Okay, we can hear her now.
During the 5th broadcast of His Excellency the President to the nation on COVID-19, he reiterated that Ghana Water Company Limited should ensure the stable supply of water during this period that we are fighting this deadly disease. And he went on that there will be no disconnection of supply. Furthermore, government will absorb the water bills for all Ghanaians for the next 3 months, i.e. April, May, and June. Added to that, water tankers, both public ones and privately owned ones, are also going to be mobilized to ensure the water supply to all vulnerable communities. I must state here that this also includes the Ghana Water Sanitation Agency. All their systems also will provide water for free. Again, all community-based water systems are to serve water to the community residents for free. All water bills for the above months for all domestic customers and standpipe users will be absorbed by government. I'm stressing this so that there will be no confusion. Also, hospitals, clinics, and other health centers will enjoy priority supply of water as they have been doing. If there's anything, they will call Ghana Water Company to quickly mobilize tanker services to serve them. We are also going to install polytanks in urban areas as well as, if necessary, the rural areas to make sure water is easily accessible. There are areas that have pipelines but are suffering from lack of water. These areas are being listed for tanker services to serve them. And these tanker services are being deployed nationwide to supply water. Meanwhile, we plead with all of us to make sure that we do not tamper with the pipelines and infrastructure of both Ghana Water Company Limited and Community Water and Sanitation Agency, so that we will have constant supply of water.
Hopefully this breaks it down further what the president said. But above all of this, there is also a stimulus package. Fred.
Indeed, there's no end to the goodies, and
hopefully
the economy must continue to run. And the Information Minister Kojo Ponkrumah has been detailing what stimulus packages are there to ensure that the economy remains strong despite the situation we find ourselves in. So he spoke at the news conference as well.
Right, we can go there.
President instructing the minister responsible for finance to make $100 million cedi equivalent available to prepare in terms of logistics, facilities, health infrastructure, public education, etc., to the tune of about $100 million cedi equivalent. 35 million of that is a credit facility which has just been approved by Parliament. It is our understanding that hopefully today the World Bank board itself should approve it so that disbursement can take place. 65 million of it is a virement of an already existent garage facility, which has already happened, and that 65 million cedi equivalent is now available to the Republic of Ghana. So just to inform the general public that the 100 million USD, 65 of it is a virement of an already existent garage facility, which virement has now taken place and the funds are now available to the government of Ghana. The 35 million is to be approved by the World Bank board, hopefully today, so that disbursement can be done as well for the preparedness program. The second part of it is the coronavirus alleviation package or program, which is budgeted about $219 million cedi equivalent. That is being taken from oil funds. You would recall that quite recently, Parliament approved a transfer of that amount of money into the contingency fund. The Constitution says that the committee responsible for financial measures in Parliament is a committee that is seized with the power to decide how that money, once it's in the contingency, should be used. So the minister responsible for finance is going to make an application, and the committee will consider it and represent to the whole or to Parliament to allow for that fund to be made available for the coronavirus alleviation program. And
so that's the information minister with the stimulus packages, you know, so there is a loan that's available. You want to get on their website and find out a bit more so you can pursue which suits you. But Fred, there was the health minister as well, who, by the way, is getting a new deputy, who a lot of people seem excited, whose appointment a lot of people seem excited about.
Indeed, Honorable Okoboy
right,
will become, after Parliament vets him, if they approve him, then he'll become the Deputy Health Minister, I'm sure. He has a foothold of this whole health area, and
right,
so having been a doctor himself, practicing doctor, so it'll be interesting to hear from him.
Certainly,
yes.
certainly. I mean, last week, just about last week, he was here. But let's not digress. That will be a very interesting conversation that we can have. But minister, right?
His issue has to do with the controversy that's arising after the president announced the package for frontline workers.
Exactly.
And so the controversy is who benefits,
who falls within the category of frontline
and will benefit. And I understand that among the health workers, there's been huge debate since yesterday about who will benefit from this.
Before this debate came, the debate that the biggest conversation among these people was PPEs, availability of PPEs. Indeed. To make them feel comfortable enough to work around. You know,
indeed, the PPE issue is still there, but because there's individual benefit to the health professionals, now everybody is asking to lock themselves in so they can also benefit. Worker. But the health minister doesn't appear to have come to a conclusion on who will benefit or who will not. What we know now is that those who are actively engaged in the fight against COVID now will surely benefit. And they've also had, there are some volunteers who are also working in this space. So the question is, how do you deal with such persons? Because the person is not on salary. So if they are enjoying tax reduction on their income, there's no income in the first place.
But they're getting 130 cedis each every day, right?
Yes, that is for, so for their emoluments, their standard emoluments, there will be tax reduction on what they get, and so you don't have to pay tax and that kind of thing. So for those people, how do they also benefit from this tax reduction, because they are already not getting a salary? So that debate has been ongoing, but he clarified and said that, well, we've not come to a conclusion on this matter yet, hold on as we engage leadership of the various health institutions to address it. Because if you realize, some of the cases go to private facilities before they go. So who are they? Are they frontline workers? Maybe yes. There are people who work in these areas. He cited the example of a cleaner who works in that area. He's not directly involved in the fight, but he's still at the front line, because if there's any issue there, he or she can be affected. He's as close to the case as the doctors they are all exposed. And so it will be interesting to know what plan they come up with. But this is his explanation as he gave at the news conference, the health minister.
Right. We have made available 15 Ayalolo buses now in Accra, and a number again in Kumasi. This operation started yesterday. The buses that we have designated to carry health workers have been labeled health staff in front of the windscreens and on the sides. These are strictly to be utilized by health workers. They have done routes that will touch in some of the hospitals and polyclinics in Accra from various parts of Accra. So the 15 buses between Accra and Tema are operating on our major roads, but they have asked them to be going close to clinics where these workers are, to facilitate their movement. They are moving during times that they start work, that will give them room to start work when they close and when the afternoon shift comes, so that when you close even in the night, there will be buses running to carry you home. We've given ample fuel, and it looks like the operation went very well yesterday. This morning there were complaints of health workers, a lot of them trying to go on a bus that would break the social distancing rules. So I'll plead with health workers who are boarding the buses that if you realize that there are a lot more people in the bus and the driver asks you to stay and wait, please listen and wait and get on the next bus that comes. The President mentioned tax relief for all health workers, and we are working on modalities to grant this tax relief to all health workers, including those even in the private sector, so that if you capture you and your employer in the private sector gives us your tax returns, they will pick your TIN numbers and will work with it such that you'll also benefit so far as you are a health worker. The other area that we have mentioned, which has caused a little bit of misunderstanding on radio, this morning I listened to one or two contributors, is the allowance or bonus that to be paid to the health workers. Please let everybody stay calm. The President is not thinking of leaving anyone behind. All of us are health workers. All of us are health workers, but not all of us will do some work that will make us take advantage of the large bonus.
So there you have it, a very detailed explanation of exactly what the frontline people are going through, including even the buses that's taking them to work. Fred is still here with me. Before I wrap up with Fred, let's talk about, look at the case count. Today we've heard we're at 287, but we know that as of Sunday, when the President briefed the nation, there were 15,000 plus cases that had been tested, and we're waiting for the results. Some
Indeed.
have come in.
So half of that came in, and we put those figures together with the 26 we have from the mandatory quarantine in Accra, and that adds up to the numbers we had today, I think 62 or so, giving us 287. There's additional 7,000 samples that are still being tested, results we're waiting for. Once those ones come in, we will know. But I think what we've got so far from the 7,000 appears to be encouraging. There's not too much in the system, and so this is very encouraging. We pray that the 7,000 that's left gives us that, and then the extra samples that are being taken, because between when the President announced this and now, the
More
contact
samples
tracers
have been
have
taken.
still been
Okay.
going around
Right.
taking samples,
Right.
and we know in some metropolitan areas or municipal areas, the contact tracers are picking samples for everybody in those assemblies. And so we expect that once we get results for the full, we'll be able to know. And then based on this, the president will make a decision on what to do with the lockdown, whether to tighten Accra, Greater Kumasi, and the other satellite areas that have been locked down or not, or whether to extend it to the entire country or not.
Right.
As we speak, the president is speaking or is in a meeting with the leadership of the Ghana Medical Association. You know, they called for the lockdown, and as the lockdown took effect, indeed, they still said it wasn't enough. This is not enough to address the problem we wanted to address. Right. And so the president says whatever decision will be based on the outcome of these tests. But now that the consultations have begun, I am seeing a future tightening of those lockdowns.
We'll see how that goes. Fred, thank you. Fred Smith is head of our health desk here, helping us with that information there.